Hi, my name is Terry Duran, and in Module 5, we're going to talk about medical information. The objectives are to discuss medications commonly prescribed for residents with Alzheimer's disease and their side effects, and detection and prevention of malnutrition and dehydration. A common approach to difficult behaviors is to go right to medicating residents with tranquilizers, sedatives, or antipsychotics. But that's risky and often not what's best. That is called a chemical restraint. Experts recommend trying behavior management first, and for good reasons. It tends to be more effective in the long run than chemical restraints and has no dangerous side effects and leads to a better care relationship. So again, as we talked about before, some examples of challenging behaviors: aggression and anger, anxiety and agitation, just general emotional distress, physical or verbal outbursts, restlessness, pacing, wandering, hallucinations, which are seeing, hearing, or feeling things that are really not there, delusions, which are firmly held beliefs or a firmly held belief in something that's not true, or inconsistent sleep, or something called sundowning, which is common in Alzheimer's. So non-medication approaches, which we call non-pharmacological approaches, non-medication approaches to managing behavior symptoms promote physical and emotional comfort. Many of these strategies aim to identify and address needs that the person with Alzheimer's may have difficulty expressing as the disease progresses. Non-medication approaches should always be tried first. There are types of medications called psychotropics that are used at times to treat the behavioral, psychological, and emotional symptoms of Alzheimer's disease. And this actually has a diagnosis. It's sometimes referred to as behavioral and psychological symptoms of dementia. The classes of psychotropic medications used to manage the behavioral and psychological symptoms of dementia include antidepressants, which again, used for depression, anti-anxiety medications, antipsychotics, which would be used in times of psychoses, mood stabilizers, and medications for insomnia. Sometimes these are called sleeping pills or hypnotics. These medications can be effective, but there are certain types that can also potentially have significant side effects. Psychotropics are typically used in conjunction with other non-medication approaches or after attempting non-medication therapies and finding them to be inadequate. Under this umbrella of psychotropic medications, we have this category of antipsychotic medications. The decision to use an antipsychotic drug needs to be considered with extreme caution. Research has shown that these medications are associated with an increased risk of stroke and death in older adults with dementia. So much so that the FDA has ordered manufacturers to label such medications with a black box warning about their risk and a reminder that they are not approved to treat dementia symptoms. So antipsychotic medications are used for things like hallucinations, delusions, aggression, agitation, hostility, and uncooperativeness. And these are ones like aripiprazole, which is Abilify. These are the generic and the brand names. This would be clozapine, which is the generic. Clozaril would be the brand name. Haloperidol, which is Haldol. olanzapine, which is Zyprexa, quetiapine, which is Seroquel, risperidone, which is Risperdal, and ziprasidone, which is Geodon. And there are more. There are also medications approved to treat Alzheimer's. Now, at this time, although there are some exciting research possibilities, there is no cure, there is no prevention, and there is no treatment to slow the progression of Alzheimer's disease. But there are 5 prescription medications approved by the U.S. Food and Drug Administration to treat its symptoms. As Alzheimer's disease progresses, brain cells die, and the connection among the cells are lost, causing cognitive symptoms to worsen. And again, while current medications cannot stop the damage Alzheimer's causes to these brain cells, they may help lessen or stabilize symptoms for a limited time by affecting certain chemicals involved in carrying messages among the brain's nerve cells. So doctors can sometimes prescribe both types of medications together. All of the prescription medications currently approved to treat Alzheimer's symptoms in the early to middle stages are from a class of medications called cholinesterase inhibitors. These cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. So cholinesterase inhibitors prevent the breakdown of something called acetylcholine. This is a chemical messenger important for learning and memory. So this supports communication among nerve cells by keeping acetylcholine high. These cholinesterase inhibitors can also improve symptoms for a limited amount of time. And really, effectiveness varies from person to person. They're generally well tolerated, but if side effects occur, they commonly include nausea, vomiting, loss of appetite, and increased frequency of bowel movements. It is strongly recommended that a healthcare provider who is experienced in using these medications monitor the patients who are taking them, and that they follow the recommended guidelines. There are 3 cholinesterase inhibitors that are commonly prescribed. The first one is donepezil, which is Aricept. Aricept would be the brand name. This is approved to treat all stages of Alzheimer's disease. The second one is galantamine, or Razidine. This is approved for the early to middle stages. The third is rivastigmine, which is Exelon, approved for early to middle stage Alzheimer's, as well as dementia associated with Parkinson's disease. Memantine is another type of medication that is used for the middle to late stages. Its brand name is Namenda. This regulates the activity of glutamate, a chemical involved in information, processing, storage, and retrieval. This improves mental function and ability to perform daily activities for some people. Now, this can cause side effects, including headache, constipation, confusion, and dizziness. There is a combination medication that combines memantine and donepezil, and this is approved by the FDA for treatment in middle to late stage Alzheimer's. Memantine is also prescribed to improve memory, attention, reason, language, and the ability to perform simple tasks. This can be used alone, or it can be used with other Alzheimer's disease treatments. There is some evidence that individuals with middle to late stage Alzheimer's who are taking a cholinesterase inhibitor might benefit by also taking memantine. But again, every single person is different. In addition to affecting the brain's ability to recognize thirst, Alzheimer's can also diminish its ability to control mouth and throat muscles, making swallowing difficult. This can make it difficult for a resident to take prescribed medications. If you notice a resident struggling to swallow, notify your manager as soon as possible. The resident's healthcare provider may be able to offer alternative medications or processes. Some medications commonly prescribed to an individual with Alzheimer's disease can have the side effect of increasing urination, and this increases the need to take in more fluids to compensate for those being expelled. Which leads us to our next area, dehydration. Dehydration happens when the body doesn't have as much water as it needs, and without enough, the body can't function properly. It worsens constipation, it increases the risk of bladder infection, and especially important in our elderly population is kidney injury. This can also aggravate asthma or lung condition and reduces mental performance and increases fatigue. Mild dehydration symptoms can simply include the dryness of your mouth or dry tongue. It can cause dark or deep yellow urine. It can cause headaches. It can be seen as crying, but with few or no tears. There can be weakness or just this general feeling of being unwell. It can make people sleepy, fatigued, or irritable. But more serious dehydration symptoms can be low blood pressure, convulsions, late cramping and muscle contractions in the limbs, a rapid but weak pulse, dry and sunken eyes with few or no tears, breathing faster than normal. But dehydration can be prevented. A good formula for knowing how much water is needed every day is to take 1/3 of the person's body weight in pounds and drink the equivalent number of ounces of water daily. For example, a 150-pound woman would need 50 ounces of water daily, or about 6 8-ounce glasses of water. The best and easiest way to assess for proper hydration is the color of the urine. It should be clear or a pale yellow, not a dark yellow or amber color. Although it can be challenging to keep a resident with Alzheimer's hydrated, here are 5 strategies that may prove effective. Prompt the resident to drink often. If possible, try to have them take a drink of water about every half hour. Frequent small drinks will eliminate the need to take larger drinks, and this can be especially helpful for residents who have difficulty swallowing. Eliminate as many challenges as possible. An individual with arthritis or muscle weakness may find it difficult to grip a cup or bring a full glass to their lips without spilling it, making them reluctant to drink. So smaller, no-spill cups can improve confidence. One-way straws can also help. There are many different models designed with adults in mind, with no cartoon characters or other markings that would label it as a sippy cup. Provide their favorites. Although water is always a good choice for hydration, it's not the only one. Those with Alzheimer's often prefer more flavorful options, especially the sweet ones. So low-calorie sports drinks and Pedialyte not only provide taste, but also salts, minerals, and electrolytes. Watered-down fruit juices are another possible alternative, as well as flavored water. Don't forget foods high in water content. 20% of an average adult's fluid intake comes from food. So watermelon, cucumbers, celery, berries, and yogurts are all very hydrating, as are grapefruits and even some soft cheeses. Recognize the early signs of dehydration. The sooner you realize that a resident may be dehydrated, the sooner you can take action. Early signs, as we talked about before, can include chapped lips, constipation, that decreased urine output, that very yellow, amber, concentrated smelling urine, and dry skin. One tried and true method of determining whether or not someone is dehydrated is the Turgor test. Gently pinch the skin on the back of the hand between the thumb and forefinger. If the skin remains tented for more than a few seconds, it's an indication of dehydration. Regular nutritious meals may become a challenge for people with dementia. As a person's cognitive function declines, he or she may become overwhelmed with too many food choices, forget to eat, or have difficulty with eating utensils. Proper nutrition is important to keep the body strong and healthy. For a resident with Alzheimer's or dementia, poor nutrition may increase behavioral symptoms and cause weight loss. Residents with Alzheimer's and dementia do not need a special diet. As with anyone, eating a well-balanced, nutritious diet is important for overall health. Prioritize consumption of whole foods to increase nutrition. These include fruits and vegetables, beans, meat, poultry, fish, dairy products, eggs, nuts, seeds, and whole grains. And try to focus on soft, well-cooked or pureed blended foods. Maybe scrambled eggs, poached fish, mashed vegetables, avocado, yogurt, smoothies, and soups, which are easier to swallow and even easier to digest. You may also try food supplements, especially in the middle to late stages. Protein powders or drinks can be helpful to their nutrition also. Aim to create balanced meals. These should have a protein source, a colorful fruit or veggie, a healthy fat, and a quality carbohydrate at every meal. And if budget allows, sign up for a grocery or meal delivery service, especially if they're kind of in an independent living situation. This can make food preparation much easier. Choose quick and easy to prepare foods when grocery shopping. Again, if it's kind of an assisted living, independent living situation. Opt for pre-made high-quality soups, pre-cut fresh or frozen fruits and vegetables, or pre-cooked proteins. And don't forget pleasure. Look for ways to increase enjoyment while eating. Choose foods that appeal. Set the table with nice linens, silverwares, and maybe even flowers. Eat slowly and savor food and allow small treats if desired. A small bowl of vanilla ice cream with hot fudge on it after dinner a couple of times a week makes life just a little bit more delicious. And as the disease progresses, loss of appetite and weight loss may become concerns. In such cases, the healthcare provider may suggest supplements between meals to add calories. Make meal times easier. During the middle and late stages of Alzheimer's, distractions, too many choices, and changes in perception, taste, and smell can make eating more difficult. And the following tips can help. Try to limit these distractions. If possible, in the long-term care setting, serve meals in a quiet surroundings away from the television and other distractions. Keep the table settings simple. Avoid placing items on the table, such as table arrangements or plastic fruit that might distract or confuse the resident. Use only the utensils needed for the meal. Distinguish food from the plate. Changes in visual and spatial abilities may make it tough for someone with dementia to distinguish food from the plate or the plate from the table. It can help to use whole, like white plates or bowls with a contrasting color place format. Avoid patterned dishes, tablecloths, and placemats. Check the food temperature. A person with dementia might not be able to tell if something is too hot to drink or eat. Always test the temperature of foods and beverages before serving. Serve only 1 or 2 foods at a time. Too many foods at once may be overwhelming. Simplify it by serving 1 dish at a time. For example, mashed potatoes followed by the meat. Be flexible to food preferences. Keep long-standing personal preferences in mind when preparing food. And be aware that the individual with dementia may suddenly develop new food preferences or reject foods that were liked in the past. Give the resident plenty of time to eat. Remind him or her to chew and swallow carefully. And keep in mind that it may take an hour or longer to finish eating. If the family member is there, encourage them to eat together. Make meals an enjoyable social event so everyone looks forward to the experience. Research suggests that people eat better when they're in the company of others. Keep in mind that the resident may not remember when or if he or she ate. If the resident continues to ask about eating breakfast, consider serving several breakfasts. For example, juice followed by toast, and maybe a little bit later they can have some cereal. During the middle and late stages of Alzheimer's, allow the person with dementia to be as independent as possible during meals. Be ready to help when needed. Make the most of the person's abilities. Adapt serving dishes and utensils to make eating easier. You might serve food in a bowl instead of on a plate, or try using a plate with rims or protective edges. A spoon with a large handle may be less difficult to handle than a fork, or even let the person use his or her hands if it's easier. Serve finger foods. Try bite-sized foods that are easy to pick up, such as chicken nuggets, fish sticks, tuna sandwiches, orange segments, steamed broccoli, or cauliflower pieces. Use a watch me technique. For example, hold a spoon and show the person how to eat a bowl of cereal. And don't worry about neatness. Let the person feed him or herself as much as possible. It might be helpful to get plates with suction cups. In the middle and late stages of Alzheimer's, swallowing difficulty can lead to choking and weight loss. Be aware of safety concerns and try these tips. Prepare foods so they aren't hard to chew or swallow. Grind foods. Cut them into bite-sized pieces or serve soft foods like applesauce, cottage cheese, or scrambled eggs. Be alert for signs of choking. Avoid foods that are difficult to chew thoroughly, like raw carrots. Encourage the person to sit up straight with his or her head slightly forward. If the person's head tilts backwards, move it to a forward position. And at the end of the meal, check the person's mouth to make sure food has been swallowed. And learn the Heimlich maneuver in case of an emergency. If the person has a decreased appetite, Try preparing favorite foods, increase physical activity, or plan for several small meals rather than 3 large ones. If the person's appetite does not increase and he or she is losing weight, consult with the healthcare provider. Keep in mind, as the person's activity level decreases, he or she may not need as many calories. Only use vitamin supplementation on the recommendation of a healthcare provider. In conclusion, although the human and societal cost of Alzheimer's disease is staggering, there is hope that earlier and better diagnoses, increased knowledge of its natural history with support of the patient and family throughout the disease stages, effective symptomatic medications, and potentially effective disease modification strategies will have a dramatic impact on the number of persons affected in the future and the quality of life of persons currently affected. The fast pace of research and development in Alzheimer's disease is unique in neurological history and should lead to a better future for aging populations.